Have you ever wondered if your body could warn you about an impending stroke weeks in advance? In today's video, we explore 7 critical signs that might appear up to a month before a stroke. If you notice any of these symptoms, it is crucial to seek medical attention immediately. Early detection could save lives. Why knowing these signs matters? Every year, over 795,000 people in the US suffer a stroke, making it one of the leading causes of death and disability. What is even more concerning is that strokes do not discriminate based on age, gender, or overall health. Cardiovascular diseases are on the rise globally, even among younger populations. By understanding these early warning signs, you will be better equipped to protect yourself and your loved ones from becoming part of these alarming statistics. Moreover, the impact of a stroke often extends beyond the individual, affecting families emotionally and financially. For instance, rehabilitation costs, long-term care, and adjustments to daily life can place immense strain on caregivers. Knowing these signs early empowers individuals to take preventive measures, seek timely medical advice, and potentially avoid life-altering consequences. 7 warning signs that may appear a month before a stroke. 1. Persistently high blood pressure. Elevated blood pressure is a significant risk factor for strokes. Chronic hypertension can damage blood vessels, causing them to narrow, weaken, or even rupture over time. This can lead to either an ischemic stroke caused by a blood flow blockage or a hemorrhagic stroke caused by bleeding in the brain. Managing your blood pressure through a healthy lifestyle and prescribed medications is essential to reduce your risk. In a 2021 study, researchers found that individuals with uncontrolled hypertension were 3 times more likely to experience a stroke compared to those maintaining optimal blood pressure levels. Regular checkups and monitoring can play a pivotal role in mitigating this risk. 2. Excessive fatigue. Unexplained and persistent fatigue could be an early indicator of restricted blood flow to the brain. This may be caused by a narrowing artery or a small clot, potentially signaling a transient ischemic attack TIA, also known as a mini-stroke. Though TIA symptoms often resolve within 24 hours, they serve as a critical warning of a possible major stroke. Many patients describe this fatigue as a debilitating lack of energy, often accompanied by difficulty concentrating. If you or someone you know experiences this symptom without a clear cause, it is worth consulting a healthcare provider to rule out underlying issues. 3. Vision problems. Sudden changes in vision, such as blurriness, double vision, or difficulty focusing, might indicate circulatory issues in the brain. These symptoms can result from blockages in arteries supplying blood to the eyes and should never be ignored. Vision disturbances are sometimes overlooked because they can be attributed to other conditions like migraines or aging. However, when paired with other symptoms like dizziness or confusion, they become a red flag that warrants immediate medical evaluation. 4. Sudden, severe headache. An intense headache that appears suddenly could signal a stroke. Hemorrhagic strokes, in particular, are often preceded by what is described as the worst headache of one's life. If you experience such a headache, especially if accompanied by other neurological symptoms, seek immediate medical help. This type of headache often differs from typical migraines or tension headaches in its sudden onset and severity. Some individuals also report experiencing sensitivity to light, nausea, or a feeling of immense pressure within their skull. 5. Numbness or weakness in the extremities. Numbness or weakness, especially on one side of the body, is a classic warning sign of a stroke. This symptom may occur during a TIA, where blood flow to a part of the brain is temporarily reduced. Even if the symptoms resolve quickly, they warrant urgent medical attention. Beyond the obvious signs, subtle changes such as a loss of grip strength or difficulty walking should also be taken seriously. These could indicate minor disruptions in brain function, pointing to an underlying vascular problem. 6. Speech difficulty. Struggling to speak, slurred speech, or difficulty forming sentences could indicate a stroke. This condition, known as aphasia, disrupts your ability to communicate and may appear suddenly before a major stroke. Aphasia can manifest in different forms. Some people might have trouble finding the right words, while others may speak fluently but incoherently. Being aware of these variations can help in recognizing the condition promptly. 7. Neurological problems. This is like memory loss, balance problems, or nausea and vomiting can occur days or weeks before a stroke. While these symptoms might mimic other conditions, they should be taken seriously if they arise without explanation. Neurological problems often reflect disruptions in the brain's ability to coordinate basic functions. For example, sudden clumsiness or an inability to maintain balance might hint at compromised blood flow to regions responsible for motor control. Understanding the types of strokes. There are two main types of strokes: ischemic and hemorrhagic. Ischemic strokes account for approximately 87% of all cases and result from blood clots obstructing blood flow to the brain. Hemorrhagic strokes, on the other hand, occur when a weakened blood vessel ruptures, leading to bleeding in the brain. A third, less common type, known as cryptogenic stroke, has no identifiable cause. Recent advancements in medical technology, such as wearable heart monitors, are helping to uncover potential triggers like irregular heart rhythms or genetic predispositions. Preventive measures to reduce stroke risk. Preventing a stroke starts with adopting a healthier lifestyle and recognizing risk factors early. Here are some practical tips to reduce your stroke risk. 1. Maintain a balanced diet. Eating a diet rich in fruits, vegetables, whole grains, and lean proteins can help regulate blood pressure and cholesterol levels. Reducing sodium intake is particularly important for controlling hypertension. The Mediterranean diet, for instance, has been shown to lower stroke risk due to its emphasis on healthy fats, such as olive oil and nuts. 2. Regular exercise. Engaging in physical activity for at least 30 minutes a day, 5 days a week, can improve cardiovascular health and reduce the likelihood of a stroke. Activities like walking, swimming, or yoga are excellent for improving blood circulation and lowering stress levels. 3. Quit smoking and limit alcohol consumption. Smoking damages blood vessels and increases clotting tendencies, while excessive alcohol intake can raise blood pressure. Quitting smoking and moderating alcohol consumption are crucial steps toward a healthier lifestyle. 4. Monitor chronic conditions. Conditions like diabetes, atrial fibrillation, and high cholesterol are significant stroke risk factors. Regular medical checkups and adhering to prescribed treatments can prevent these conditions from worsening. Recognizing the FAST acronym. In addition to the early warning signs, it is essential to remember the FAST acronym for identifying a stroke. Face. Is one side of the face drooping? Arms. Can the person raise both arms, or is one weak? Speech. Is their speech slurred or strange? Time is critical. Call emergency services immediately. By acting fast, you can significantly improve the chances of recovery and reduce the potential for long-term disability. The emotional and social impact of a stroke. The aftermath of a stroke extends beyond physical health. Survivors often face emotional challenges, such as depression, anxiety, and frustration over lost independence. Support groups and counseling can play a pivotal role in recovery by offering a sense of community and shared understanding. For caregivers, the journey can be equally demanding. Balancing caregiving responsibilities with personal well-being requires adequate support systems and access to resources. Organizations like the American Stroke Association provide valuable tools for navigating these challenges. Innovations in stroke treatment and recovery. Advancements in medical technology are revolutionizing stroke care. From clot retrieval devices to telemedicine consultations, patients now have access to faster and more effective treatments. Rehabilitation therapies, including robotics and virtual reality, are also enhancing recovery outcomes by improving motor skills and cognitive function. Conclusion. Understanding the warning signs of a stroke and taking preventive measures can make a life-saving difference. By staying informed and proactive, you can protect yourself and your loved ones from the devastating effects of a stroke. If you have found this video helpful, share it with others. Spreading awareness is a vital step in combating this silent threat.